Ronnie Warn was bewildered when he spotted the sign on the door of the Santa Ana office where he routinely brings used needles and picks up clean ones. The Harm Reduction Institute was closed, it said, due to unforeseen circumstances. Warn turned away from the homey building on 4th Street and tried to calculate how long his supply of clean syringes would last him. Decades earlier, the 60-year-old had first gotten hepatitis, the enduring result of turning to a used syringe when he was desperate. When you're sick on heroin, you don't care about the needle being dirty, Warn said. You take a chance, because you want to get well. Outside of Santa Ana methadone clinic on a Thursday, he greeted Harm Reduction Institute workers who handed him a backpack loaded with supplies. Shampoo, oranges, socks, a plastic bag with naloxone to reverse an opioid overdose. But no packs of needles. When they run out, Warn said, I don't know what I'm going to do. Orange County has been a perennial battleground for the fight over syringe programs, which are backed by state and federal health officials as a life-saving tool but have been anathema to some local governments and other critics who denounce them as a hazard and nuisance. As it stands, Orange County is the biggest county in the country without a program providing syringe access, according to the California Department of Public Health. The Harm Reduction Institute, then part of the American Addiction Institute of Mind and Medicine, halted operations at its Santa Ana offices earlier this year. After Santa Ana yanked its occupancy certificate, workers with the program hit the streets to hand out naloxone and other supplies, but they could not distribute packs of clean syringes. With the needle program closed, people are using whatever they can. Whatever they have, said Steven Woodson, 51, a program volunteer who said he takes methadone to keep away from heroin. They're going to do whatever they've got to do. That's the horrible part. Many of the Harm Reduction Institute's clients are homeless, which means it can be hard to find them on the streets as they are shunted from place to place. Carol Newark, its clinical operations director, said that not having a consistent place for people to access syringes has also really put a damper on our efforts to try to get people into treatment. California officials have long tried to pave the way for programs that give clean needles to drug users, championing them as a proven way to clamp down on HIV and hepatitis infections.